Good afternoon. My name is Stephanie and I'm here to prep you for your procedure. How are you doing today?
Good.
This procedure is a one-day task and you'll be out of here and on your way. You're in very good hands and the staff here is amazing. Mohs surgery, like I said, is a one-day procedure, but it is done in stages throughout. The surgeon carefully removes a layer of tissue and observes it under the microscope to see if any cancer cells remain, and if they do, the surgeon knows where they are located. The surgeon repeats the removal while trying to save the healthy tissue until all the cancer cells are removed. Mohs rate is recommended for high-risk, non-melanomal skin cancers on the face, such as the nose, lips, ears, eyelids, and also non-face related places like the hands, feet, and genitals. Mohs is also recommended for basal cell carcinoma, also called BCCs, or squamous cell carcinoma, also called SCCs, that are large, aggressive, or growing rapidly, that have indistinct edges or have recurred after previous treatment. BCCs are abnormal, uncontrolled growths or lesions that arise in the skin's basal cells, which line the epidermis or the outermost layer of the skin. BCCs often look like open sores, red patches, pink growth, shiny bumps, or scars, and are usually caused by a combination of cumulative and intense occasional sun exposure. An SCC is basically a BCC, but is in squamous cell carcinoma. They can become disfiguring and sometimes deadly if allowed to grow. Mohs surgery is performed by doctors who are specially trained to fulfill 3 roles as someone who removes the cancerous cells, as a pathologist who analyzes the lab specimens, and as a surgeon who closes or reconstructs the wound. A surgeon specially trained in Mohs surgery, pathology, and reconstructive surgery may draw some marks around your lesion with ink to guide the treatment, then inject a local anesthesia to your face. Using a scalpel, the doctor removes the thinnest possible layer of visible cancerous tissue. Myself or an assistant bandages your wound and shows you to the waiting area. The surgeon then color codes the tissue with ink to map exactly where it was removed from your body. Next, a technician processes the tumor in the on-site laboratory by freezing the tissue so that it can be readily cut into paper-thin sections like a stack of dimes and placed on slides. The tissue on the slides is then stained and the Mohs surgeon examines these slides under a microscope. If the doctor finds any remaining cancer cells, the areas are pinpointed on the map and you're called back into the operating room. If the anesthetic has worn off, the doctor numbs those areas again before precisely removing another layer of tissue from each of the locations where cancer cells remain. Because this procedure happens in stages, it is my duty to remind you that it may take hours, but it is worth the wait because this procedure has a 98% cure rate. If the doctor finds that cancer cells remain, he will do the stages again until all cancer cells are removed, which has to do with the expensive time manner. Because he is taking skin from the face and has to reconstruct with stitches, there is a likelihood of scarring, but the surgeon is a trained professional to do the reconstruction. Just like any wound, it is important to take care of it during the healing process. You should not touch it with dirty hands and decrease exposure to the sun. After the surgery, I will schedule a follow-up appointment with you to have your stitches removed. How's that sound?
Great.